Minister, record all of them, and you'll answer them in 30 minutes.
Thank you, Mr. Speaker. I stand to ask question number 75 for 2025. Can the Cabinet Secretary explain why informal sector workers are no longer able to remit monthly contribution to the Social Health Insurance Fund SHIF under the Social Health Authority SHA, including being required to make top-up contributions when they are receiving medical services from hospital, creating discrimination as this requirement is not imposed on salaried individuals. Number two, can the Cabinet Secretary
Order, Nabulindo and Oundo. This is not a market in your region.
And the Cabinet Secretary clarify whether any assessment has been undertaken on the impact of requiring annual contributions from informal sector workers on their right to access affordable health care. And finally, number three, outline the alternative payment models accessible to informal sector workers and measures put in place to ensure inclusivity and flexibility in the remittance of SHIF. I thank you, Mr. Speaker.
Could the Cabinet Secretary A provide a report on the number of Kenyans that have registered with the Social Health Authority, including measures taken by the Ministry to sensitize the public on payment of premiums and the benefits available under the package offered by the authority? Question 2, clarify on whether indigents are subjected to a means testing process, and if so, provide a report on whether claims by indigents have been fully paid for and the number of indigent households that have benefited under SHA. 3, outline the current uptake of premium financing and the utilization of the Lipa Pole Pole scheme under SHA for Kenyans in the informal sector. Number 4, provide the status of recruitment by the SHA and whether staff of the defunct National Health Insurance Fund, NHIF, have been transitioned to the authority. Number 4, indicate the status of the suspension and investigations of health facilities that had integrity issues, including actions taken by the ministry to resolve the matter and ensure accountability by the health facility. Number 5, clarify whether the Lulo and Urban Private Hospitals Associations, RUFA, allied facility are accepting and treating SHA members in their facility. Thank you, Honorable Speaker.
Naisula.
The ministry has put in place to avert a potential tuberculosis crisis, as many patients are resistant to its drugs for treatment, including ensuring timely access to prevention, testing, and treatment services. Question number 2, outline the actions being taken by the ministry to secure affordable treatment for multi-drug resistant tuberculosis, considering its more challenging and prolonged treatment regimen. Number 3, state the efforts in place to preserve and build upon the progress previously achieved in the fight against tuberculosis through USAID funding. Thank you, Honorable Speaker.
Waziri.
Honorable Speaker, the member for Nyandarua County, Honorable Faith Gitau, asked 3 questions. The answer to the first one on where the ministry has put in, what are the ministry measures put in place to avert a potential tuberculosis crisis as many patients are resistant. The answer is that Kenya as a country, we have made a very commendable progress, Honorable Speaker, in the fight against TB. And why do I say so? We have achieved a 41% reduction in TB incidents and 65% reduction in mortality towards the 2025 TB strategy milestone. So That 65 reduction is that there are very few people now who are dying because of TB closes in our country. And this is commendable. But there's a burden of this, the burden of the drug resistance TB, particularly the DRTB, has also dropped by 48% since 2015. Increased domestic financing at both national and county level. The annual TB budget for the financial year, Honorable Speaker, 2024-2025 was US $136 million, of which government funding covered only 1% and donor funding 20%, leaving a 79% funding gap. We will appeal to the House, the National Assembly, which is a budget-making house, for increased resource allocation. But, Mr. Speaker, I don't want to say much, but we are talking to our colleagues under the new U.S. administration, and we are coming up with a substitute for USAID. And I think by the end of this month, the country will hear the good news. That we might not call it USAID, we might call it something else, but we are negotiating, and by the end of this month or early next month, we will find a way of how we can bring back the role USAID played, because USAID was key in this area. And then, of course, we are collaborating at the multi-sectoral level to make sure that there's accountability. And so sectors like housing, nutrition, correctional services, and labor, we are also telling them how to address the social determinants of TB. Thank you, Honorable Speaker. But just to finish, we will, through Honorable Gitau, and we will write to the House, we will ask for more allocations, but rest be assured that TB control will closely linked to poverty, it's closely linked to poor housing, it's closely linked to poor nutrition, and that's why we have to adopt a multi-sectoral approach and talk to other stakeholders for accountability framework. Thank you, Mr. Speaker.
Faith Gitau, you're satisfied?
Thank you, Honorable Speaker. I want to confirm to the Minister that we have no TB drugs in Nyandarua, and most of the hospitals around, in Kenya, do not have these drugs. Please, you have said that you're providing free of charge. When do we expect these drugs in our hospitals?
Minister.
Honorable Speaker, I was in Nyandarua 3 weeks ago. I want to confirm to the House there are plenty of TB drugs in Nyandarua. And I am ready to send my officers to Nyandarua with the Honorable Member to go and verify. I am ready, Honorable Speaker. I cannot lie to this House. The TB drugs are available in Nyandarua County, in all the hospitals, and I'm ready, under your direction, that the Director General of Health, approved by this House, is here. I will dispatch him to Nyandarua tomorrow and to confirm to the Honorable Member.
Fair enough. Kagusha.
Thank you, Honorable Speaker. Could the Cabinet Secretary in charge of health clarify whether there is an outstanding debt amounting to Kenya shillings 450 million shillings owed to Consolata Hospital, Mathari, and of course 433 million to Nyeri County hospitals, including 36.7 million for Mukurweini Hospital and 236 million for Tumutumu hospitals.
That is
and
not
this comprising
order,
of...
Kagusha. That's not your question. You are not allowed to go beyond what is on the order paper. So just read out your question. You can ask those other figures in your supplementary.
Thank you, Honorable Speaker. And this amount comprising of arrears accumulated at the National Hospital Insurance Fund and payments for the Social Health Authority, that is NHIF and SHA. Number two, state the factors contributing to the prolonged delay in remitting payments to Consolata Hospital Mathari, despite the provision of health services to patients. Of course, Honorable Speaker, I would like just to note that the fraudulent payments in millions have also been made to disgenious hospitals, while genuine ones are missing out. Honorable Speaker, number 3, outline the measures put in place to ensure the debt owed to the hospital is promptly settled and its operations fully restored. Number 4, provide a timeline for the payment of the arrears and dues accumulated from October 2024 to April 2025 to Consolata Hospital, Madari, by SHA. Thank you, Honorable Speaker.
Minister.
Honorable Speaker, on Consolata Hospital, Madari, I first want to clarify that the NHIF legacy debt, and that is one of the problems, biggest problem that we are facing as a country, and which is making the implementation of the Social Health Authority a bit bumpy, because many of the questions that are raised on debt are on the legacy debt of NHIF. As of 30th September 2024, when this House enacted the new Social Health Authority Act, the NHIF liability owed to Consolata Madari Hospital stood at 153 million. This facility falls under the category of health providers owed amount exceeding 10 million shillings and is subject to verification and validation process as mandated both by law, by the Constitution, by the PFM Act, and by the presidential directive prior to any payment being made. So, Honorable Speaker, and I've attached the letter that Kenyans who are owed between 1 shilling to 10 million of the former NHIF debt, amounting to 5.3 billion, accounting for 92-93%, will be settled. And I've written to the Minister for National Treasury, and I'll table the letter, that he puts it in the supplementary estimates. And currently, Honorable Speaker, using the audit, pending verification audit led by the former Auditor General and the leadership of Social Health Authority, we are auditing and we are verifying and validating all the pending bills of NHIF. On SHA payment status for Consolata and outstanding payment, the overall SHA settlement rate for all our faith-based organization facilities, whose their bills and invoices and claims have been verified, reviewed, clinically checked, and are ready for payment and paid, is standing at 65% as of today. Consolata Hospital Madari will receive 29,324,966.47 for claims which are currently being processed by SHA. They have been validated, they have been reviewed, and they have been confirmed that they are the right claims, and they will be paid in the next payment cycle, which is the 14th of November next week. Honorable Speaker, I've also provided a table summarizing the payment status of Consolata Hospital Madari. And this is a document. Since SHA started, Honorable Speaker, over 372 million have been paid to Consolata Hospital Madari. And that constitutes about 17,432 claims. In October of this last month, we have received 4,792 claims, totaling 81 million. And they are the ones which are under review. Honorable Speaker, it's good to say it here on the floor. And the leadership of Consolata We have told them, we have shared with them, they said with the claims managers at SHA, a total of 335 claims have been rejected with a money value of 14,799.325. And Honorable Speaker, if you allow me, what is a rejected claim? A rejected claims is number one, if that claim you have lodged and the patient was Honorable Duale, the Minister for Health, if that claim does not have a claim form, I am sure every member sitting in this house, when you go and see your doctor, there is a claim form that you sign. The first part of that claim form, it is the patient who signs your name, your address. The second part of that claim form is signed by the doctor attending to you. And the last part is signed by the hospital administrator. We have situations where, number one, there's no claim form. Number two, a claim form is written with one biro pen with the same handwriting. That claim is rejected, is fraudulent, and it will never be paid. So Consolata has a rejected claim of 335, totaling 14 million. We have returned claims totaling 15 million. 877, Honorable Speaker. What is return? When certain important documentation are missing. Invoice is not itemized. Documents are missing. Those are not rejected. The law allows you to go back, bring those documents missing, and you don't need to bring them physically. You just need them to upload into a digital superhighway. Then sent for payment, which will pay by the 14th, is 29,324,966. Then they have got 127 million, a total of 2,800 claims, which now is under review, and our doctors, clinicians, the system is reviewing. Is everything in order? We don't want to pay unless we make sure. So in total, Consolata is not even the 450. It's 676,205,000, and I've given the order what is due, what is required for documentation, what has been sent for payment, and what is rejected, and what they need to provide. On the factors contributing, Honorable Speaker, to the prolonged delays in, some of them I have said, but let me say the problem with the Consolata, and I hope the Member of Parliament will go on, because we have told them ourselves. The complex claims. Consolata Madari Hospital submits high-value complex claims for service, such as surgery, oncology, dialysis. These high comprehensive medical claims, they require very comprehensive medical review as part of the claims adjudication in order to process to ensure adherence to established clinical, contractual, and financial compliance. They must be subjected to some audit. So if it's oncology, we must make sure the cancer patient was there. He has gone through all the systems. We have to check the ID card. We have to, if it is surgery, we must make sure there's theater notes and all the other. And all this is for compliance because of the contractual obligation, because of financial compliance, or because of standard before payment. And the claims under review are for the period 12th of August to 30th of October. Number two, with the Consolata, we are facing what we call provider submission issues. There's delays, which are largely occasioned by provider-based factors. If they take long to provide submission of documents, if there are missing signatures in those documents, if there are incorrect patient details, and if there are low resubmission rates for correction, then the Social Health Authority will not be blamed. And we are telling all facilities, public, private, and faith-based, including our referral hospital, going forward, they must employ dedicated staff, managers, claim managers, who will make sure from morning to evening they are dealing with claims and reimbursement and work closely with our county and relationship managers for different categories. Honorable Speaker, the last question was, and then we had an issue of, we took long in terms of claims management, but I want to say that because of many litigation and court cases, at least now, SHA has since hired 9 case management officers, and recruitment is going on to build the capacity. The third question, Honorable Speaker, was to outline the measures to put in place to ensure the debt owed to hospitals. I think on the NHIF legacy debt, the claim of Consolata falls above the 10 million threshold, and we have subjected it to comprehensive verification and validation process mandated by the President and the Cabinet. But Honorable Speaker, let me now speak as a Kenyan. I think Parliament at some stage will come and talk to you. I think there are facilities, and they are both in public, private, and faith-based, that face imminent closure because of the NHIF legacy debt. I think we must do whatever it takes, and I will do it myself as the Minister for Health in consultation with the President and the Cabinet to make sure that we resolve this. Because once we resolve that, then I think a lot of the questions are on that legacy debt. On NHIF claim settlement, as I have said, we are reviewing our medical review capacity. We have done full automation of the claims processing using AI-driven in collaboration with the Digital Health Agency. And now we have a faster verification and timely payment. And we have enough money, Honorable Speaker, to pay our facilities. We are doing also stakeholder engagement. I led a meeting with all the bishops who run, and the different churches that run, and the SUPKEM who run faith-based. And we have agreed, we have created individual relationship managers. We have set a number of private sector players in Nairobi and the surrounding counties. When we do our rollout, SHA rollout, we also engage with the people. But I want to ask Honorable Member from Kroini that even tomorrow we will engage with the Consolata Madari Hospital so that we reconcile our accounts, because they provide very important facilities. But Honorable Speaker, if you allow me, I had 2 weeks ago, I had met in Rumuruti the CEO of Tumutumu, the CEO of Chogoria, and the CEO of Kikuyu Eye Hospital. And they sat with our team led by Dr. Masi. They have reconciled the claim submitted by Tumutumu is 276 million. Payment completed is about 137 million. In October payout, they received 14 million. We have a rejection of 21 million for Tumutumu, and we have under review close to about 103. So we are engaging them, and all our PCA hospitals, we are talking to the Secretary General. So on a daily basis, we had the Deputy Secretary General of PCA, and on that occasion, I'm the one, Honorable Karani, Dr. Karani was there. I'm the one who asked, please come with the big hospitals, and we did, and we have reconciled.
Sure.
Thank you very much, Honorable Speaker. May I start by thanking the Cabinet Secretary for having given me students for Mukurweini KMTC. The students have now reported, and they have started learning. And actually, they started learning today. And for that reason, Honorable CS, I want to very sincerely thank you very much on behalf of the people of Mukurweini. Honorable Speaker, it is indeed true what the Cabinet Secretary has raised, that Madari Hospital and Tumutumu Hospital and other faith-based hospitals in Nyeri County faces imminent closure, especially because of what he has called the legacy debt owed by the NHIF. And of course, we also have other private providers in Nyeri County and other counties that have that challenge. Honorable Speaker, the issue of Mathari Hospital having claims which are high value, which are quite sophisticated and complicated, is not a surprise because this hospital offers very good machinery which is advanced and which also is quite sophisticated. And for that reason, there is need to get a working formula with this hospital so that they do not get unnecessary delays in terms of their refunds. Honorable Speaker, one of the issues that is being raised by quite a number of doctors, and I had a chat with a doctor by the name Gudigol from Nyeri County. One of the issues they are raising is some of the requirements by SHA, which are raising ethical and legal issues. When, for example, Honorable Speaker, SHA requires you to provide written notes after every surgery by the doctors. One of the issues which is coming out that this information is quite sensitive, and if this information has to be passed through the what the CS calls the information superhighway, sometimes it's also considered to be an insecure information system. And you can imagine what kind of damage this information would do to the patients if it lands in the wrong hands or if it gets out there in the public. And of course, Honorable Speaker, this also is seen to be against our Data Protection Act. And I think the ministry, SHA and the ministry will actually need to come up with this, to come up with a way of handling this information. The last issue, Honorable Speaker, is that in Mathari Hospital, which is handling a lot of oncology issues, they are also missing coverage for a number of cancer treatment and diagnosis procedures, like the biopsies, histopathology, immunohistochemistry, cancer staging CT scans, which are very important in diagnosis of cancer, and of course, which are also pretty expensive. Some of them go up to 40,000 and above. So, Honorable Speaker, there's an issue maybe that we also need to be addressed. Lastly, Honorable Speaker, very lastly, I can see the Honorable Chair for the Health Committee is also here. Honorable Speaker, you remember I raised a question here and a statement request on the issue of blood transfusion reagents and blood bags in the country. Honorable Speaker, now it is well over 7 months or 8 months since I raised this question in this House, and the chairman has not responded even after approaching him privately, personally, severally. Honorable Speaker, maybe you need to prevail upon the chairman of the committee to respond to this very important question, especially now because the CS says that the US is returning their funds, even though through a different name other than USAID. Thank you very much, Honorable Speaker.
Leave the chairman out for now. Chairman, prepare and bring a response next week. Minister?
Mr. Speaker, the Social Health Authority was enacted by this House, and it aligns to the data protection. The same with the Digital Health Agency. And if member from Croatia, and thank you, you came to my office, I am happy I have complied on the MTC issue. And that's why I want to tell you, this is a government that delivers. When leaders come, despite their political orientation, we serve the people of Kenya. But SHA complies with the Data Protection Act mechanism in place. 2, patient consent is also availed. But let me bring to the attention of this House, Honorable Speaker, that claim adjudication requires verification that the service took place. The doctors who are talking to you, and I'm sure they are watching me, one of the basic, I'm not a doctor, but I sit with the doctors every day in Afia House, and next to me is the Director General of Health, who this House has vetted and approved, And in section 16 of the Health Act says he is a technical advisor to the minister and government, including parliament. In medical school, in theater, for social health authority to confirm a procedure has taken place, that facility, that doctor must provide theater notes. Minus theater notes, that claim is rejected. I'll give you another more simple example. If a delivery, a maternity delivery has taken place in a facility, whether through C-section or normal delivery, and you want social health authority to pay, part of the claims document, there must be a very important document known as birth notification. If there is no birth notification, then how can SHA pay you and prove that a child has been born? You know, Honorable Speaker and members, we should not compare the social health authority to the defunct, corrupt, with no system NHIF. They are world and world apart. It's like first world to third world. It's like day and night. So the people who used to be paid millions of shillings for birth or maternity without providing birth notification, that will not happen anymore. Without, even Honorable Speaker, now for a doctor to use his authorization, pre-authorization, OTP, he must be within 500 meters of the health facility. There were days when doctors and healthcare workers could could use their OTP to authorize from their bedroom at midnight. We want doctors, when they want to use their pre-authorization code, we want them, and healthcare workers, we want them to go and visit and do it in the health facility, meet the patient, see the condition of the patient. Never again will theaters and health facilities be run using the mobile phone of healthcare workers. Honorable Chair, I don't want to go into the blood services. I have done the answer. The chairman, my chairman, is very capable and competent, and I'm sure when the time comes, he will provide the answer.
Kazi Mtandaza.
Thank you, Honorable Speaker. I rise to ask question 74 of 2025 to the Cabinet Secretary.